started. My name is Kim Gokenauer. I am the Nursing Home Operations Executive. We're here today to give you some information and communication on updates on our renovation plan and where we're going in the next 3 years for our end result of our new facility and renovation of the current facility. So today I have with me Kristen Wooler, our Assistant Administrator for Mount View. Mary Wimmer, many of you may know, as our social worker on our Legacies program. Lindsay King, she is our resident relocation coordinator and also a social worker for us here. Carrie Slaminski, our long-term care ombudsman for our building. Cheryl Rye, our unit manager for the post-acute long-term care and rehab department or units. And then Jessica Meadows, our communication and marketing specialist. So I have not done this presentation before. This is usually parts of the things that Michael does. And Michael, unfortunately, today is on vacation. Well, not unfortunately. He's on vacation, a well-deserved vacation with his family. So I am the new, you get me today. So there may be questions we can't answer today. We will take those, we'll take down that information and we'll go from there. What I do ask ahead of time is that you hold your questions till the end. We'll get through the presentation and then we'll answer questions as we go. Is that okay with everybody? Okay. So thank you for joining us today, first of all. So just a little bit of the history of the project for our project here at North Central Healthcare. In 1972, the current building, this big building, was built for the healthcare center. That includes all of our human services programs, the aquatic therapy pool, all of those pieces. In 1976, the aquatic therapy pool was added on to this big campus. In 1983, the building that we're currently in is the Mount View Care Center was built and commissioned to be built. So I know, Ron, you were probably here back in those days, right?
Yes, I was.
You worked here for us. And so we knew that our building was aging and we needed to do something for the whole campus. We currently cover about 500,000 square foot in the current way our building is laid out. It's too big. We have security concerns. We have lots of different issues that we worry about with this building. And so we needed to make it a more user-friendly, less entrances, and modernize the building for the people that we take care of in all of our programs. So in 2017, we started working on a master facility plan. It was part of our 5 to 50 vision, that in the next 5 years will be our 50th anniversary. Where do we want to be so that we can create an environment that will last the next 50 years beyond our time here? So that's where this kind of starts from. So in April of 2018, about a year later, after doing lots of research, lots of looking at facilities, all the different programs, what's the best look, how do we manage every need that we have for this campus, we presented a plan to Marathon County Board. So in June of that year, they did approve initial bonding for the project. This project came out to be about a $72 million project overall. The nursing home portion is about a third of that process. So we are the largest piece of this project in the big picture. In 2018, back in April and June of 2018, we had a conceptual design that was first presented to the board. In September of 2018, we went back and we hired our architectural firm to design the true building. So from that, the building has changed a number of times, and we have the architectural firm of Angus & Young, and they're working specifically with an architectural firm in healthcare, which is MKM, based out of Fort Wayne, Indiana, and they have done healthcare builds for hospitals, nursing homes, all the different things, because we encompass a large different things. We have clinics, we have an inpatient hospital, we have assisted living, we have nursing home. So this is a project we needed an expert to be able to pull all those pieces together to meld it so that we got the best product for the overall campus and overall for North Central Healthcare. So in September we got that hired. And then at the end of February 2019, we had our first preliminary designs, which again were presented to the county board. And they also went out to the neighborhood associations and into the community. There were some exchanges and changes made to that based on some feedback. And we got the updated plans of that. Should be our next slide, right? Nope. So when we looked at our project goals for this, we really looked at what do we need to be, what were the 10 factors that we were looking for to make this a successful project moving forward for North Central Healthcare. So we wanted an efficient clinical operations. Now mind you, these are just renditions. This is not necessarily what the building's gonna look like. This is just a rendition just to kind of give you some ideas. We wanted to improve our wayfinding and security access. We have over, how many entrances do we have, Jess?
125.
We have 125 entrances to this building. When we get done with this project, we'll be down to 4. So that is going to be, from a security and a safety piece, that's very important to us. Incorporate evidence-based design. That's where we hired the specialists in the field for the design and the architectural piece of this to support higher acuity. So as we know, we have 1 of 5 ventilator-dependent units in the state of Wisconsin. We want to make sure that we are continuing to able to provide those cares, but look at other needs as we move forward and create an environment that can support that. We also wanted to take the deinstitutionalized feel of the facility and make it more home-like. This is your home. This is not get rid of the cinder block walls. Make it look more like a home front versus a nursing home. We also want to be able to make some operational changes. We want to be more efficient. So we want to make our pathways easier and nicer for our staff members to provide the cares that they provide here. And also look at ways to make it a shorter path, walking paths, where their supplies are located, all those things that are important that take time away from doing what they do. So we took into consideration those items. We also looked at how can we consolidate this space. 500,000 square feet is a long building. If you walk from one end of this building to all the way to over by the pool, it takes you about 15 minutes. There's emergencies, that's a long walk path. The new design that we're going to show you is going to make that path, piece very much more condensed for emergency prepared and all those things. We also wanted to meet our regulatory compliance needs, so we know we needed to change some things to make sure that we stay regulatory with the federal and state laws that govern our businesses. We also wanted to be a leader in educational programming and create a building that can also do educational training for up and coming staff and folks in different areas. And then we also wanted quality workspaces. We wanted spaces that families and staff felt comfortable working in their environment. And then for Marathon County, they had 3 areas that they really wanted us to look at. They wanted to make sure we maintained our high quality of care. They wanted to make sure we were financially sustainable, that we could make sure we could make the payments for the $72 million bonding we're asking them to put up for us. And they also wanted to make sure we had a comprehensive approach for the county of where we're going moving forward for the services we provide. So this is the final site concept. So when we look at the whole concept, you see this part that's Marathon County. This is the part of the building we will not be using. This will be Marathon County's portion of the building. It will be used for other needs by the county. Where our current building, where we are currently, is here. The second floor is going to be renovated for a nursing home. The first floor will have our outpatient and community treatment, our pharmacy, lab, and then all of our administrative offices will be in this portion of our building. There will be a connecting walkway on both the first floor and the second floor into the new piece, which is the new 4-story tower for nursing, which is where currently our Evergreen Place neighborhood is located. So we will be building a new story for that. And then directly next to that, connected, will be our aquatics program, which is the aquatics, our new aquatic pool, which our open house for those interested, our groundbreaking is on Monday at 2 o'clock. So if you're here and would like to attend, we'd love to have you. So this will all be connected. So when you look at this, and then over here will be our new youth hospital, and our existing CBRF is just relocating to this area. And then in this part where current crisis and behavioral health is, this will be our hospital and our medically monitored treatment. So when you come in the building, you will come in off of the Marshall Street entrance, which is the nursing home entrance currently, and it'll break off into different sections, and I'll show you that a little bit, some slides of that a little further on. So this is what the main entrance to the nursing home will look like. This is, we took into consideration bringing the indoors, the outdoors, and really creating an environment that uses different materials to show the building and to really fit into the neighborhood and bring the nature back into our building. This is just a view like I was talking about, the entranceway. It will be opened up, so you'll see the tower here on your right-hand side, the community housing, and the existing Mount View will be back there. So it'll be different parking lots for those 3 areas. This is just another view of where the assisted living and youth hospital will be. This is another rendering of the front entrance of Mount View. This is where the bistro will be that will be available for staff, family, residents, and the community. We'll have an entrance with outside seating and indoor seating that will be available for people to come, grab a cup of coffee, a sandwich, those type of things, and actually be able to have, there's a seating area down there. It's beautiful. So this is really part of that. All that front lobby area is all glass, so it outlooks over the environment. This is a view of how the tower with the aquatic pool's connected. So the aquatic pool is actually, there'll be a hallway. So you're gonna park over here to do your pool therapy, but if you wanna go down the hallway and go grab a cup of coffee, the bistro will be just down the hall. Just a view of the building from nights with aquatic therapy, how the lights all are shining down, so it's not intrusive to the community, to the neighbors across the street, trying to keep some of that in place as well. This is just an internal view of what the pool concept looks like for the new pool. Another view of the pool. So the next step you're kind of wondering is, why are we looking to make these moves at this time? So there's a lot of phasing parts to do this building. So the first phase that's going to go into effect is we've already put out to bid our aquatic therapy. We've gotten our bid back, and that is phase 1A. So we have to get ready to do this portion of the building, which the breaking of the ground is at, like I said, Monday. At the same time, we're putting this out for bid for those assisted living and CBRFs. So that is also going to be started here shortly as well. So the phase, which should be between August and September, that both of those will be started. The goal is that the aquatic pool will be done mid-year next year, ready to move in by April, is what the plan is. The next phase is 1B, which is the tower for the nursing home. This is going to bid in middle of August. We're finalizing some of the plans on that, and that's why we need to get this area moved so that we can make room to do the deconstruction of the current Evergreen and medically monitored treatment area. So with that, it's why we have to move folks to get ready for the tower. Once they start breaking ground on the tower, which also includes our dietary and some of our support service areas, they anticipate about 18 months for that to be finished. Phase 2 then, once that piece of it's done, we're going to move over to the current existing Mount View, and we're going to work on second floor and first floor and get those renovated. And that's somewhere within the January 2021 timeline at this point. And then phase 3 will be the building D, which is currently our hospital, our crisis CBRF, and our Lakeview Heights will be the final phase to be done here on phase 3, and that's where the new MMT will be moving to eventually. And our final phase is phase 4, will be the decommissioning of the garden side crossings, and this will become all new parking lot and entrance for the employees. So employees will be parking in the back portion of the building. This will all be for families, clients, residents. So this will be completely separate. You won't see staff parking in this area. They'll all be parking back here and entering through our back part of our building. And that is planned for 2021. So I'm going to turn this over to Lindsay. Linz, many of you know Linz. You've probably had some communications with her. She has been doing a phenomenal job keeping us on task and making sure that, with me being between 2 buildings currently, she keeps me in the loop on everything that's going on currently.
All right, I'm going to ask the same question. Can you guys hear me okay? holler if I'm kind of quiet, okay? So Kim has given us a wonderful just idea of what we're looking at coming forward. Through that process, they have decided it would be a good idea to have somebody internally helping to manage that process of moving residents and transitioning units for the residents and for the staff. So that will be my role to you guys, is to really just be an organizer, a communicator, and kind of a central person to be a contact as we're giving you information about what's going out and as we're starting to make plans for when people need to do those moves and transitions. Okay, so kind of it's been a big task, but it's kind of fun. This might help us just kind of understand as we're looking at those pictures. We anticipate 3 phases of resident moves. It has been something we're trying to really put some thought into, is what's the least amount of moves we can do for everyone. We want you to be comfortable while you're here and not to be, you know, moved several times because we're under construction. So this has become our plan. So Evergreen Place inside one of Garden side will be moving to our open nursing home unit here on the 2nd floor called Southern Reflections. Okay, I'll talk more about that move then. So when the tower is built, so in about 18 months, we would anticipate to do the 2nd move, and that is when everyone on the 2nd floor and on the 1st floor here at Mount View would move into the new tower. And then our 3rd move would take place as well. Individuals will be living in the new building. They will be doing construction here in this section of the Mount View Nursing Home. And that third group of people to move will be the ones who are on legacies coming into this section when it has been remodeled. So at this time we are looking at 3. So for most individuals that will be just 1 move. There is the individuals that are coming over in this first phase that will have 2. Okay. Whenever we are looking at resident moving, and especially in this situation, we want to be conscious of what's your rights. You have the right to continue to receive good and adequate care in the least restrictive environment. You have the right to be informed of your moves. You will always be given notice. We want to give you the opportunity to tour those places and to look around. And then, you know, some reasonable accommodations and to try to have input as you can based on the space and the move that we're doing, to get your feedback before the move so that everybody is comfortable with the plan. I do work with Carrie, our long-term care ombudsman, and I do also work with Tom Leduc. He is the nursing home transition ombudsman. So he is an individual whose job it is to really make sure that nursing homes are doing their best for the residents when they do have to make these kind of large transitions. So a lot of great ideas have come from these individuals. They are also a good resource for families and residents as you're just wondering, is this the right thing for Mount View, or is this the right thing for my loved one, and if you need someone to talk to about it. All right, so that first group of residents that will need to move, we talked about being Evergreen and Garden side 1. At this time, the team has decided it's about 50 residents. There are a few from each program that will come this way, but in the end, Evergreen and Garden side 1 need to be empty. So we anticipate to do all of those room changes, about 50 in 1 day. From what I've heard from Carrie and from other nursing homes, and from that this is doable. We have a team of staff, we have a team of volunteers, certainly families are welcome, and we have a good plan in place that this is doable. So that will be Wednesday, August 28th. We anticipate everyone to have breakfast in their usual breakfast environments, and then they will have a large group and plan. We have a plan for activities so residents can have some ease during these moves, and then the staff are going to get to work. So we are moving all the personal items, so the bed included. So if your loved one or you're the resident, you're comfortable in the bed you have, it's coming with you. We are looking at having maintenance guys here that day so we can get your pictures hung up and things like that. We want the resident to roll into their new place having it look put together and like home again. So, if you have any opportunity during this next few weeks that you want to do a little cleaning, you know, sometimes over the years residents have come up with a large supply bingo where they've gotten some extra shirts or shorts that don't fit anymore. If you want to take any of that kind of stuff home, you can. It's just less that we will move. So I do know for our legacies individuals who are moving, your closets are a little more narrow, but your drawers are a little bigger. So it's a little give and take on your space there for clothing, but all right. We have done a lot as a team to try to make the unit where everyone is moving to ready to go, and certainly our biggest concern was the safety. A lot of individuals, you guys have seen that there is a difference in the look in the environment. And so our job was to make sure this was safe for all the residents and for the families. We have done things like we will be securing the elevators so that residents who may not know where they're going are not able to get you know, lost in this large area. We anticipate closing the double doors here so there's not a lot of through traffic, so that the area may stay a little calmer, and you know, people again may not be lost in the large area of Mount View. Elevator doors, we talked about, stairwell doors will be secured. So just doing a lot of things that we can think of ahead of time to make this unit secure. The tub room and shower room have been redone. Well, the shower room was, we have a new tub upstairs, so that will be nice. That residents will have either one, and they again are both private, but we've done some work there. The dining, a lot of you will not have that one large dining room. At this time, we anticipate that dining will be in the ends of the sunrooms. A beautiful view, but we will take a peek at that, and we anticipate there may be a little bit of a time that the meal times may change by a few minutes, but we, I think as we get a system, we'll be able to get that down. But just, I know a lot of families, mealtime is a nice time to visit or check in or know that your loved one is going to be on the unit versus at an activity or something. So we do anticipate for the residents moving over, there will be a change in the laundry. We are not able at this time to put washer and dryer machines on the unit, so we will have residents' personal clothing going to our facility laundry. So the turnaround may be a few more days than what they're used to for personal clothing. And then two, we are just asking that we can go ahead and get everyone's clothes labeled, just to kind of help with the process that things aren't misplaced, or if they are in laundry and they're being delivered by our laundry department, it just kind of helps them know where to put things. For the individuals whose loved ones or residents will be moving over to our Reflections unit here, the best and easiest parking is going to be to park at the Mount View main entrance. Come in through the first floor and then use the second elevator there by your unit. We anticipate when the fences do go up for their construction that we will lose an exit that I think a lot of you are used to in that link hallway. And so this will be your best entrance and your closest. Okay. The nice thing is through a lot of this, our parking lot should remain pretty open here at Mount View, so for visitors and families, you still have good access. And then we will see if, as things do change, our bus stop entrance may change. We do know we have some staff, visitors, and volunteers that use our bus stop right up front. So even some of our outpatient therapy people come by bus. So we will we'll keep you notified if any of that changes. All right. So after we move everyone, we know that this transition is going to be pretty difficult. But we are doing all the work beforehand to make it really smooth. But we know that after we do these moves, we need to check in. We need to do safety assessments. We need to talk to the families, to the residents, and to the staff to see how things are going. So we don't want to just move you and then say good luck. We have a plan in place for you guys to have open communication back to us, saying, you know, whatever your concern or need is, I can continue to be that person. You still have your social worker and your nurse manager, but we need to stay and keep the communication open after the move to really help everyone settle in and to get a good routine. Some of the things that we will be looking at is certainly safety of the residents. Just checking on all our residents. You know, if you move homes, you're a little maybe disoriented to where things are at or which hallway you're going down. So just helping to make sure the residents and families are doing okay. So we will continue to communicate then with you after, and please just let us know after the move if there's anything we can continue to do. All right. That's just another photo where we anticipate the fencing. So this is going to be Mount View. This will be your Southern Reflections unit. So you guys are coming from here to here, the majority of those who are in this first move. So when this parking lot's open, and you'll see kind of, it's a faint red line, but we anticipate that kind of getting cut off and our parking lot being in the middle. So this is where you want to go, Mount View main entrance. And just, I think we may have sent that. If not, we can get those pictures to you too, just if anybody needs help finding their way around. Okay. Again, we talked about we would continue to communicate with you. I think one of the best ways is going to be, we've got the boards up in the hallways. We have several websites. We have Facebook sites for those who are tech savvy. I will continue to send letters home, and we certainly anticipate getting these groups together again as we have more information and as things start happening and progressing along, so you can just continue to be involved in the pretty exciting plan we have going here. Questions?
How is the size of the new nursing home compare with the current size, and what about storage space, closet space?
Great question. So the rooms are probably going to be a little bit smaller than some of our current units, but once we get closer to the design, when the design is finalized, we are actually going to make a mock room that will actually have all the furniture in there, the shower, the tubs, so that you as families and residents can actually see the rooms. It won't maybe have every single fixture like what the final fixtures and finishings are, but it will have the pieces in there so that you can see the size of the room and what it looks like. So we'll have that in a future meeting. They got to build it.
I can add to that too. You know, currently we started out as everything being double rooms. There's parts of actually Legacies where they were 4 rooms or 4 people to a room to begin with. So it's hard to say in comparison, because the majority of people will be going from what they are now living as a double room to a single room. So that makes it a little
I think in the plan, they're all private rooms except for 10 rooms will be double rooms. So there'll be about 20 people that would share rooms. So we kind of did that intentfully because of families, like there might be husband-wife couples that would like to be together, those type of things, or relatives, that kind of thing. But otherwise, all the rooms are private in the tower and over here in this portion of Mount View as well. The 3rd and 4th floors of the new tower will have really nice views. 2nd floor will have okay views, but not maybe as nice. And then this view will stay the same on this floor, obviously. There will be family rooms on the 2nd, 3rd, and 4th rooms. They're actually looking at having outdoor gardens on some of those, and there'll be a roof garden on top of the 2nd floor. If you see here, this will actually be a rooftop garden on top of the bistro area. So there's different areas of how we're trying to incorporate that back into the full area. There'll be this front patio area, but the residents, this patio in the back, even though this is really not necessarily all of it's also going to be shared by other departments, this will be available for families and residents to use as well as our back patio area.
I have a question. My husband's in the Evergreen unit, and I think that open concept design with the rooms on the perimeter is so superior. He's been in other nursing homes, and I just really like that. What is the arrangement for the
So I can't give you the exact drawings yet because they're still working on them. They've done some preliminary. We as a team have gone back and met with them and made some recommendations and changes to it. I can tell you that this side of this building will be gutted out. So all the internal walls will be taken out of here and redesigned. It will not have that rounded feel. I'm sorry we can't make that occur, but we'll do the best we can to keep it as open as possible. The ones in the tower are more of a rounded square, so it does have a little more of that feel. So, but we'll do our best we can up here. This is all gonna get like this, all these walls are coming down and this is all getting redesigned. Once we have those designs, we'll be sharing those with you as well. They're still finalizing some of where things belong and where things go, but we will get those to you as well.
Mom wanted to know if the rooms will be staggered as far as, will the doorways be right across from each other the way they are now here?
I don't know that until I can show you the design.
That's what I thought. Thank you.
But good question. I honestly don't know.
Are the rooms gonna have their own shower?
Yes, all the rooms will have their own showers, so that will be something new that we haven't had before. We'll also have tub rooms for people who prefer whirlpool baths and that kind of thing, but every room will have its own shower in it.
And are they gonna be grouped the way they are now, or are they gonna be grouped differently?
I can explain.
Well, right now, we're in long hallways with maybe 14 or 15 people.
No, the new design, when we can show you the new design, which I'm sorry, Troy, who is our planner for this, is off on vacation, and we're in between, we're in rendition number probably 16, 17. The rooms are all kind of in a square, so it's a smaller environment with centralized dining in the tower area. Here, it's kind of the same situation where there's small built-in areas that are open for gathering, and it's not just long halls. We tried to break those in so that it's not all long halls.
Thank you.
You bet.
What about physical therapy?
Physical therapy will be in the front part of this first floor of this new tower. And also down there will be a new activity community room that'll seat about 150 people. So instead of having bingo and groups in here, in your dining room like you now do, you'll have a separated, nice big room for events and church services, bingo, music groups, all of that. Plus there'll also be small areas on the units that like for small group activities as well. We won't lose that. Okay, I'm gonna start here and go around, okay?
You mentioned that the first move date is August 28th. Do you have an approximate time for the other moves?
So we're thinking, the plan is after this first group of moves, we wouldn't move anybody for about 18 months. That is when the tower will be finished. Then we'll be transitioning folks to the tower rooms so that we can clear this area out for renovation of this area. So about 18 months up here.
My question is, this first move that we're talking about, the garden side and Evergreen to the Southern Reflections. And you're saying in 18 months they will get moved to the tower area?
Some of them will. Some of them may get moved back to garden side for a while, to the second side of garden side, because we got to make sure we have enough beds for everybody where we need to move them. We're still working through part of those details. But they may end up moving back to garden side for temporarily.
But if they move back to garden side, then they would have to be moved to the tower eventually.
Tower or back here to this unit. We're not quite sure yet.
Okay.
We're trying to make the moves, like Lindsay said, we're trying to minimize the number of times we have to move and disrupt folks.
Especially for the residential.
Absolutely. I'm 100% with you on that, but sometimes we have to do what we got to do to get the building done.
Yeah.
So we're trying to minimize as much as possible.
Thank you.
Is there any way that they've set aside a place to be used as a chapel?
It'll be part of that big 150 room community room. We couldn't from the budgetary. I mean, 72 million sounds like a lot of money, but when you start putting all the needs that we have for the campus, it doesn't go as far as you'd like it to go. So the community room will be also used for church services and those things as well. Anybody else?
One other question.
Sure.
From the safety standpoint, when you have a multi-story area, in case of like the severe weather we just had, or heaven forbid, fire,
Yeah.
how do you have an evacuation plan? for
We will have a new,
wheelchair?
we have one currently, but we'll have to create a new one based on the new layout of our building. One of the things that's nice about this building, this design, is we can bring people down to the second floor of the new part of the building, and you have 2 other entrances and the first floor. You have 2 other exits to move people out of. So if the fire is contained here, we can move everybody from this program over into the tower and put them behind the 2-hour firewalls. So there is some real flexibility in this design from a safety design from that piece, what you're asking. We'll also be developing what type of tools and needs we'll have to move people if we would have to evacuate the building. So that's coming, it's coming.
Right, sounds like you've given it some good thought.
Yeah, that was one of the safety features. Whoops, I'm sorry, I don't mean to run into Lindsay here. We really looked at the safety. We want to make sure that it's, you know, we have everything in place for that. Lindsay, are we giving tours? Anybody
We
wants
are
them?
more than open to if someone would like to see the reflections unit. We are getting it cleaned up and ready to go, so you'd be more than welcome to take a walk through.
We also have some refreshments. We have some, I think, juice and coffee and cookies back here, so please help yourself. We'll be here to answer any other questions you may have. And thank you for coming, and we will have more meetings coming up. There'll be more, like I said, we'll have more of the floor plan probably. I would say sometime in September, and don't quote me, but I'm guessing by September we should have a finalized floor plan that we can show you. We may even have the mock room set up that we can show you as well. So more to come.